Hi, my name is Dr. Ross Hauser. Welcome to the Hauser Neck Center, and we're here with a very special guest, the other Hauser, Marion Hauser, who's our CEO here at Caring Medical Florida and the Hauser Neck Center. And while you guys know me by watching the YouTube videos, what you may not know is just how horrible much of the last 3 years has been. So that Mary and I's lives changed basically about 3 years ago. So I'm going to have Marion tell her story, and we all can learn so much by her persistence, her tenacity, and how she's been able to get back her life after a horrific bike accident. So Marion, you and I have been biking for much of our lives, and that's something that we've really enjoyed. And tell us kind of what transpired in February of 2019.
Well, we were cycling with our buddy Bill, and most Saturdays, that's what we like to do. Do like 30 to 50 miles on our road bikes. We go pretty fast. We've done a lot of triathlons over the years, so cycling down here in Southwest Florida has been a really awesome thing to do on the weekend. Get out, have a coffee, and at the halfway point and come back. So we were doing our usual cycle, going out to Captiva from Sanibel, and stopped, had our coffee when we got there, and then we were coming back. We were going down Sandcap Road, and some other cyclists came and kind of joined on our little group, and then they were going really fast and erratic. And that's one thing that I like about our little group, is that we're very safe and we call out things, and you feel really comfortable. But I didn't feel comfortable with this group of people who were with us, so I yelled out to Ross, I'm gonna drop off, because I don't like the way this feels. And so then he was in front of me, so he slowed down, and I didn't slow down enough, so my front wheel hit his back wheel. Like, I can still see it. It was like, here's his wheel, here's my wheel, and it's kind of going like this. And I'm like, oh, I don't want it to hit it, but I didn't want to slam on my brakes. So it literally just tapped your back wheel, my front wheel. And then my bike just went down like that, down all on my right side. And, I can still see that happening. We're right in the middle of the road. My right foot, unfortunately, did not come unclipped from my pedal. So when I fell, I landed on, my head, my shoulder, my hip, my knee, my ankles, and my foot stayed clipped. So I'm laying there in the middle of the road, still clipped into my bike. My bike is all mangled. My head had hit the pavement. And then obviously everybody stopped, and thank God there were no oncoming cars or cars from the back. And all the cyclists, stopped, and then they asked me if I was okay, and I'm like, yeah, I don't think so. And I crawled to the side of the road, and then it was still sort of funny, because there's this girl in the cycling group who's into natural health, and she's like, you want some oils? Do you want some homeopathics? And I took those, and then I started losing consciousness, and I said, guys, you gotta elevate my feet. I do not want to pass out. So anyway, that happened. They got me over to the side of the road, and I'm thinking to myself, oh, this could be maybe just a bad road rash kind of situation. But the rest of them left, and we were there, and we're just trying to figure out what to do. And then this Good Samaritan in a minivan came by and asked if we needed any help. So the lady took our two bikes and me and Ross and put them in the back of her minivan and drove us back to the house. And I love alternative medicine. I don't like traditional medicine, so I did not want to go to the hospital. I didn't want to do anything. I wanted to just see how everything was going to go. So they got me into like our basement, and I'm laying on the couch, and I thought to myself, this is not good. Something's really bad here. It's just not good. So that's when you said, well, I think we should take you somewhere. So we ended up getting in the back. They laid me in the back of the car. Ross's mom and dad happened to be down, so she went with us. and we drove actually to the urgent care instead of to the emergency room because this was in February and it was flu season, so there's like the ERs are full of people with the flu and you can't get in. So we went to the urgent care, and just throughout the whole thing there were so many amazing, people would call them coincidences, but to me they were God moments. One of our friends, Maureen, just happened to be going to that urgent care and
at exactly the same time.
Exactly the same time, and we had a wheelchair that we had used for my dad, so it was in our car, and so Ross was wheeling me up there, and she's like, "What are you guys doing? Why are you here?" And then she started praying over me right there, in the parking lot, and then they wheeled me in. And to make a long story short, basically I had the X-ray there. What do they call that view?
Well, there was a lot of different views, but basically this part of the pubis that you broke, in
so that's on
a
the right
couple
side,
places,
my foot just.
Yeah, pubic fracture.
So I take an ambulance ride, and Ross and Mom go in the car, and they meet me there, and I'm in hallway N. There's no rooms. They did pretty much nothing. They basically had an ortho look at it. He said it's a non-surgical fracture. So, basically go home and, figure it out.
Good luck.
Yeah. I said, well, I can't bear weight, so what should I do? And he goes, oh, you want some crutches? I'm like, well, my shoulder was just jammed from this whole injury, so I can't really use a crutch. So I just can't even tell you how thankful I am that we do what we do, because if I wasn't in this industry, I don't even know, I might not have even been able to ever walk again. So
part of it is we just wanted to basically tell your story and then what transpired after that. So, and just for the people that would watch us, the pain was unbelievable. You couldn't bear any weight. It was just unbelievable. So then we basically, dragged you to the house, and here's some of the,
that's the road rash from this elbow, and this was after a few days. This is my hip. But I guess to let you know how I was, I couldn't bear weight. So I didn't go to our upstairs bedroom. I was in a guest bedroom, and there was a bathroom kind of close there. And then Ross had a big beanbag, and he was sleeping on the beanbag because I couldn't transfer to get out to go to the bathroom. So the motion to get up out of the bed like that, I couldn't do it. So this happened on a Saturday, so he had to go to work on Monday. So basically we're trying to get me to where I could, semi-function. And I'm also a non-narcotic person. I've never taken narcotic pain pills, so I didn't want to take any. And you might think that is absolutely ridiculous with a bone fracture, but we alternated Tylenol and ibuprofen, and then came up with a bunch of concoctions with supplements and essential oils. And I pretty much managed it through that, and a lot of prayer. But I didn't take any pain meds. And probably that concoction of taking Tylenol and ibuprofen was only for probably about 2 weeks.
Why don't you just talk about when you got home and you're in the bed, and then our cat Marmalade, who's orange. What did Marmy do once you got home? So
pets are amazing. They sense when you're ill. So Marmalade just came into that extra bedroom, and she just literally would lay right on my pelvis and just purr and just lick me and comfort me. So she stayed with me in there the whole time. And I also got an amazing amount of support from friends and neighbors and staff. They sent me flowers, balloons, fruit, yellow roses. As I looked back preparing for this talk, I found that I had taken pictures of inspirational and Christian sayings that I would read in my daily devotions, and you'll see some of these throughout the talk, but these were ones that I had actually taken to help me through. And I think if I didn't have faith, I believe everything happens for a reason, and you'll see throughout this whole course that a lot of things happen for a reason. It was not something I would wish on anybody. It was totally just an accident, and I'm not mad at those other cyclists, but I'm not going to ride with that group anymore. But This was one of them. Trust in the Lord with all your heart. Do not depend on your own understanding. Proverbs. So to me, it seemed like, you could have just wallowed in it, like, why did this happen to me? But I tried to always figure out what was the greater good throughout the process. And obviously I have a lot more empathy for people who have injuries too.
Yes, for sure. And then...
So my dad would stay with us prior to his passing, and we had a lot of devices in the house that we still kept, and strangely enough, why did we not just donate them? But this was one of those pushing wheelchair walking aid things.
Yeah.
So when I first started bearing weight, that's what I would use, and this actually had a little compartment. I could put my supplements and my stuff in there. I actually went and cooked dinner, crazy enough, using that thing. So I think the key point in this is you got me moving ASAP. Mm-hmm. It wasn't lay in the bed and just wallow there. You said, you got a gigantic wheelchair with these big wheels, and they wheeled me out onto the bike path and took me around to get outside in the sunshine, and then wheeled me into the backyard, and then soon after we got into the pool.
Yeah, the pool was key.
And then my friends will tell that part of the story, but they know I love food, and you have to fuel your body with things to keep you healthy. And one of the things that's a problem if you can't, part of it was that this is the pelvis, so I didn't know if I could urinate or defecate well. And I certainly didn't want to get constipated and then have to try to bear down with this fracture and the pain. So my friends made sure I had a lot of veggies and good nutrition to keep that from happening. Yeah, and then, gosh, this was part of the amazing part of the story. So our friends, Mary Lou and John Cash, were planning on coming anyway, right?
They lived in Texas.
Yeah, so she was one of the first nurses that we hired originally back 20 years ago.
In the 90s.
Yeah, and then she and I became really close friends, and then we became friends with John when they got married, and we would always see them 4 times a year or something like that, and we'd vacation in Sanibel together. So they were very familiar with Sanibel, so they were planning on coming to visit us anyway. And so they ended up coming, and John loves to grill, so the part of what Mary Lou just took over, the care. And the first week was Nicole, right?
Yeah.
So Nicole is our marketing director from Eugene, Oregon, and she just happened to come. She was scheduled to come that Sunday, and I remember you calling her on the phone, and she's just like, what? And so she ended up nursing me back to health that first week, because they came the second week, right?
They each ended up spending 3 weeks total, but 6 weeks where we had friends around the clock.
Yeah, so it was a week of Nicole. I mean, and so Nicole had me at Ross had to go back to work.
Yeah.
So she now was left with someone who can't transfer. So literally it's, hugging me to get me to sit up, swing the legs over, walk me to the bathroom, sit me on the toilet. Then she literally had to, help me wipe. I couldn't even, because this arm, well, I couldn't go back there. So, talk about a friend. This is our coworker, but, Anyway, so, it was to that point. Just brushing your teeth and doing all of that was crazy. So here's Mary Lou making up her essential oil concoction. So she put, frankincense and peppermint and lavender and a lot of things for bruising and for pain. I think there was clove and lots of things in there. So she made a concoction that she literally just put all over here and here and here. And then we used DMSO, Correctex, and that really went away amazingly fast because of that. And then I was taking a bunch of supplements. This is like a blood thinning one to just, because you're not moving around as much, you don't want to have clots, and then vitamin D and Deep Blue and some other, and this is just for soft tissue healing, and then drinking a lot of water. Yeah, so Ross, went back to his rehab medicine days and prescribed my initial rehab. So we started in the pool a couple days after the injury.
2 or 3 days.
3 days later.
Yeah.
So his prescription was 1 hour in the pool twice a day. So when I first went in there, I couldn't, it was hard to get out of the wheelchair and then get down the stairs and then to start walking again. But literally by the second day I was able to. So this is Lori Fanning. She's a really great friend, and she and I used to run together. So she was on board for, I mean, these people came every day.
Yeah.
Someone came in the morning for an hour and then in the evening, like around 5. So the goal for day 1 was to stand on my own, to bear weight, and to balance. And obviously in the pool, what are you at 10% of your body weight when you're in there? So this is 5 days in. That's when I started walking by myself. I got a smile on my face. Like I was really happy to be out there and, you know, getting myself back.
When someone has an unstable fracture, you do have to cast it. But when you have a stable fracture, like it's like an animal that maybe fell or something or tripped on something. You know, the animal can't just lay there for, you know, they have to ambulate. So it turns out when you have a stable fracture, motion is actually going to be something that actually helps the bone heal quicker. So, well, you got a big treatment, huh?
Yeah. So that first treatment, like I remember it was in room 6 and like just trying to get up on the table, like out of, you know, with that walker thing, like it took like a couple people to help get me even up there. Mm-hmm. And then, I mean, I'm not a crier, but I cried just to get on the table. And then another staff member who's Rachel, which a lot of you know, she's a prayer warrior. So she had to go in there with me and she held my hand and just prayed over me. Kathy would just like rub my legs, and Mary Lou too, while the other nurse and Ross were doing all of these treatments. So I had all of this on the first time, and I'm always one of those people who gets like one area treated, and I've never had like all these things at one time. So I had right hip, low back, pelvic floor, ischial tuberosity, pubis, hamstring, and right shoulder. And then this was the charting.
Yeah, that's good.
And then I had like a weird thing with urination. Felt like I had to go all the time, but obviously it was part of the pelvic fracture situation.
Why don't you explain the grapefruit?
This was like a golf ball or a grapefruit. Like it felt like I was sitting on my sit bone very close to the vagina area, that I was sitting on a grapefruit. Like that's what it felt like. There was this huge ball there.
All the time?
All the time.
Yeah,
sitting, laying, standing. So obviously walking, when I felt it, that's very unpleasant. And then this was another one I put up there. If you want specific answers to prayer, make specific requests. So sometimes you just pray like in general, but you know, I was praying directly for healing. I felt like throughout the whole process I didn't really give up. I mean, I think maybe one time I cried or 2 times, but most of the time I was pretty strong. End of March,
okay. So
probably 3 weeks.
Okay. You
said I could weight bear on land. So I've been doing all the weight bearing in the pool, so when you're at 10% body weight. So you said try to walk the cul-de-sac, which is like 0.2 miles or something, right, there and back. And then Mary Lou was doing that with me. So one of the things that was fun for me that you did, this is only one picture, but you bought me a bunch of plants and some dirt and some pots. There were some other big pots, and like I call it dirt therapy, because like digging in the dirt is just really gets your mind off of things. And then Nicole sent me some hiking socks. We had a trip to Yosemite planned in the end of April, and the fracture was February 2nd. So I basically had 3 months.
2.5 months.
2.5 months.
After a pelvic fracture to try to go to Yosemite.
Yeah, and that's not like easy hiking.
Yeah.
So, you know, it's climbing and all of that. So that was one of my goals, is to not have to cancel that trip. Yeah, that was my first day back. And then this was something that really hit me good. Pain is your friend. Pain is your ally. Pain tells you when you're wounded badly, but you know what the best thing is. It tells you that you're not dead yet. And so through the process, there's been a tremendous amount of pain. It's painful to get all those prolotherapy treatments. I don't use any kind of meds. I don't like the drugs. I don't like the feeling of that. So throughout all of these treatments, I didn't. You know, I have a very high pain tolerance, but I think this even upped it even more. So.
Oh, so then you got your second treatment.
Yeah, so then we treated the neck, the low back, the pelvic floor, ischial tuberosity, pubis, and the hamstring. And so from my chart, patient's ability to walk is increasing daily, but I still felt that pressure in the pelvic area. And then I graduated to walking outdoors, and then I was able to walk a mile, and then you had me doing squats and glute medius exercises, 3 sets of 20. And then Johnny Cash came back, Mary Lou came back, and then she was really liking working with us, and she actually was between jobs, so that was just a crazy situation, how this was like a sunset beach walk, like we were able to actually walk out there to the beach, and we had like a little picnic out there, and we started talking like, well, would you ever think of moving here? Anyway, to make a long story short, she started out part-time here. That was in May, so then she ended up moving in the fall.
So within a year?
Within a year.
Yeah, they moved. They bought a house, and
Yeah.
they live within 2 miles of us.
Right.
Okay, your third treatment in the office.
Yep, more of the same. So I rode the stationary bike for 10 to 20 minutes in an easy gear. And then I walked on the treadmill, 2% grade, 20-minute per mile pace for a mile, 5 reps up and down a flight of stairs. You had very specific things for me to do that you prescribed, functional training, squats, etc. And then these were, again, things that were just ministering to me. Blessed is the one who endures trials. There's no hurt you can't experience that Jesus doesn't understand. So that was one of the things, like if I was starting to feel down, I would think about like Jesus on the cross.
Yeah,
like talk
true.
about the epitome of like pain and suffering. So this was like nothing compared to that. So that really strengthened me through the process. Yeah, and that was the stationary bike that I got back on. So we took one of our like guest bikes and put it on this trainer so I could start back. And the first part was like, you're feeling that pressure back there. So just sitting on there. And then I remember even when you wheeled me on the bike path, a few days after, there were people coming at me on their bicycles. And it was like a little bit of PTSD, kind of like, oh boy. But then I said to myself, like, I'm getting back on that bike. I am not going to not. And my bike was totaled, by the way. Like, you took my bike, which was my bike I really loved, that I had fitted, that I've used for 13 years. And you took it to the mechanic and asked him if he could fix it. But the front was all mangled.
No, you can't.
And so that was actually sad. It was like a death because we'd done a lot of events with that bike and everything. But I did.
We did get expertise from other people, so it wasn't just prolotherapy and
us. You did take me to a pelvic floor specialist just to make sure there was like no internal injury, which there wasn't. But because of all the muscle imbalance from trying to compensate, like when you do Kegel exercises, like I couldn't do them as strongly. So she gave me some exercises to work on where you had to hold it, and then like practice getting that back strong again. So I actually bought some new hiking shoes, assuming I was going to do it.
Okay.
So I tried them out, walked to Algiers Park, which is like a couple miles. And I said to myself, we get knocked down, but we're going to get back up. We're not destroyed.
Oh wow, look at that. First day back on the bike, 10-mile ride. Wow. Those are great pictures. Look at that.
That wasn't like my fast bike. That was
but that would be an upright bike.
Upright bike with the big fat seat. Yeah, no, it was a momentous day to get back on there. My helmet was totally cracked. So this will be my public service announcement that I do not want to see anyone on a bike. Moms and dads, don't just put a bike helmet on your kid, put it on you as well. Like, I did not get a head injury. I fell and hit my head. I had road rash on my face. So I obviously hit the pavement. So
that going like 18 miles an hour.
So I mean, I cannot, even if you're going 10 miles an hour, you need to be wearing a helmet. And then they have these ones now with the MIPS in there, multi-directional impact protection system. So that was my new helmet, which I still use today. So I made it.
Wow, that's amazing.
Yeah. So this was like April 25th or 27th or something like that. And this, I just wanted to show some of these trails. It wasn't like it was just like walk through the park. It was definitely some aggressive hikes. And that's Nicole, who helped us through much of it. That was the 10-mile day.
Okay.
And this was elevation of 6810.
Wow.
And that's me, like, I made it, yay. So
that was amazing.
That was
within 3 months of having that pelvic fracture, which we'll show later.
So I wore those compression shorts and pants, and even at work I was wearing like compression shorts to stabilize the pelvis. Like there was no other bracing or anything like that. So
well, you had no abdominal, your abdominal muscles were completely shut down. So you had no, like, because of the fracture, the muscles just shut down.
So like if I would press especially my lower ab beneath the belly button, like I couldn't even feel it. Even to this day, like right now I'm still working with physical therapy to get my abs stronger, which they're way, way better than. But at this point, I couldn't even contract them because just like contracting with that fracture was like impossible. So even at this point, I made it at 3 months, but the journey like continued after this.
Yeah. But I guess maybe the point is you've got to have goals.
Yeah.
So you had set goals and then you needed some guidance and then you followed all the guidance. And obviously prolotherapy played a role, but so did physical therapy, so did friends, so did faith.
Yeah, so this is after I got back. So we continued more treatment. My ankle and my knee ended up getting treated also. My goal was I wanted to get back up to like our 40, 50 mile rides on the weekend. And so then I was able to do 15 miles twice a week during the week. And then the goal I wanted was to improve my speed.
There are injuries that are severe enough that you would use prolotherapy for acute pain, because normally, you know, we treat chronic pain.
Right.
But obviously, if somebody has a severe injury, like you had a severe injury of your shoulder, you had a severe injury of your hip, you had a severe injury of your pelvis, then after those things started getting better, then we realized you actually did have an injury of your neck, you did have an injury of your knee, you did have an injury of your ankles. So, and then chronic pain is when the body doesn't heal an injury by 3 months. So people don't realize chronic pain is, if the body doesn't heal something by 3 months, it's likely you're going to have chronic pain. So obviously, if it's a ligament injury, we would say, or a labral injury, like you had some labral injuries that we treated, that's another reason why we use PRP with certain things, then we would suggest that you get prolotherapy. So
at the beginning it was more frequent, like every 2 weeks.
Right.
And then here you'll see like it's now getting more stretched out.
Well, you could see too that because prolotherapy resolves some of your pain, obviously not all of the pain, but because it resolves some of the pain, you were able to do more. And because you're able to do more, that sped the healing up. So
Absolutely.
You can imagine, we often thought about like, geez, if you weren't in a prolotherapy practice, the doctors would have had you bed rest, blah, blah, blah. Like you would have ended up with chronic pain. You know, like chronic,
Absolutely.
like disabled.
I wouldn't be doing this.
Right. So
No.
you could see the difference. That was part of the reason to do this video. Like,
No, and like just thinking back into that ER visit, like they literally just discharged me and said, you know, figure it out. I mean, I'm like crazy. So like, I mean, I just want to encourage anybody who ever has any kind of, even if it's not that bad of an injury, but you need to see somebody who's, you know, motion and
be active.
exercise. And
then here's Al at the bike shop, A&E Bikes, and that's your new bike that he's giving you your new bike.
So that took months for it to come in and everything. And then I love this picture. We were going underneath the Sanibel Causeway, and I just put it there so I could take a picture of it.
Wow, look at that.
And then Izzy put this together like just to get a snapshot of like all the treatments. So she started in March, all of the dates. This is kind of shocking to see it like this. I had to get out of like those real severe pain and get those ligaments healed. And then I was doing exercise on my own, but I wasn't able to get fully back.
It's like prolotherapy got you maybe relatively quickly 75% better.
80, yeah.
But then both of us realized like you actually had so much inhibition of muscles. You can imagine when you don't use your abdominal muscles for a year, and then you're relying on the ligaments to support the weight of your pelvis, and the ligaments were never meant for that. That's why we have really big abdominal muscles and really big lower back muscles, because to bear the weight, the pelvis to bear the weight, you need those muscles, and the muscles were just so atrophied. And that's when, and we'll actually get to meet later your physical therapist, who Dr. Gray has done a great job.
Yeah. So in May to July, I started 2 days a week with Back in Motion, trying to, like, my shoulder was still not fully functional. Like I could probably go to here, you know, and obviously now it's like full function. I can do everything with that with no pain. And then working on the thoracic and pelvis. They have a pelvic floor PT, so she actually did some internal physical therapy for about a month and a half, I think, of helping me bear down and be able to strengthen those muscles too.
Okay, then 2021.
Yeah, 2021. More treatments throughout the year. So we didn't give all the treatments in this, but part of it is to show, like I'd say it now became more of a chronic thing. So I'm a very active person, still doing athletics, trying to get rid of all of that pain.
So once every 2 months you were getting treated.
I still felt like flabby, old, and I wasn't able to get myself back to like what I was doing. Like I was running maybe 3 miles and I was riding, 30 miles or something on the bike, but I just felt like I just was never going to get back. And so at church, it was a sermon, and at the end of the sermon, they said, does anyone have, you want God to do a miraculous move in your life and to heal you of whatever it is. It could be a physical thing, an emotional thing, whatever. So I went up there to the altar and prayed with a person up there, and they even put oil on my head, and I prayed for this remnant pelvic problem. And then that was Sunday, and like Monday or Tuesday, I get a text from Dr. Gray, who I had worked with, the prior year, saying, and I'm sure it was just a follow-up, saying, hey, I was just thinking about your case, wondering how you're doing.
Yeah.
I mean, I think that was God. I don't think that was by chance. And so then I said, actually, I'm not doing that well. I want to cry, actually, because I feel like I peaked and I can't get past that. And so I started back with him. We kind of had a new plan, new goals. And then I reached a certain plateau, and he said, not a plateau, but a gaining of strength. And he said, I really think you'd be good to start personal training. And at first, and I think he said that to me before, and I said, no, I have too much work. I can't do that. I don't have enough time. I don't know where I would fit that in.
Yeah.
And so that's another thing too of your own mindset, and you have to work on your own health and make time for it, and work isn't everything. You need a work-life balance. So I then asked my coworker Mandy, who's my right-hand person manager, COO, operations manager, if she would want to work out with me, because I asked Dr. Gray, I said, is it better to work out with someone? I mean, and I've done personal training many times with what I'm going through, and he said, yeah, absolutely, it'd be better.
Yeah.
So she and I in the fall started running, and then in February we started doing strength training together. We've always had training partners over the years. Obviously, you and I have been training partners for many years through all your Ironmans and.
Well, even this morning, I wouldn't say I woke up feeling like I want to go work out, but because you wanted to work out, we worked out, and that really helps, because there's lots of days, man, you just don't feel like working out. But if your training partner is going to be there.
No, you're meeting someone.
Right.
So then it's accountability. And with Mandy, not once has she ever canceled, and not once have I ever canceled on her.
You end up working out better. Like, you actually do more. You're faster.
No, and then like if you're lifting a certain amount of weight, she's going to say, well, I want to lift that same amount of weight too. So you work harder, you stay consistent, it's more enjoyable. You smack talk to each other or have fun or talk about serious things, pray together, whatever. And then you'll end up crushing your goals and you improve your overall mental health. And that's one of the things she has said to me many times. Like, she just feels more prepared at work. Because even though you're getting up at 5 and you're doing this at 6 to 7, taking a shower at the office, making our smoothies and all that, it's a lot of prep time and it's a lot of effort, but it makes you a better person, and you work better, and you're more clear-headed when you're working. And I think you actually, like, endorphins are a positive thing that happen when you work out, so I think that you actually are happier.
Here, we'll just talk a little bit about the actual injury. So you fractured, this part of the bone, and then obviously there was a lot of shearing force, and of course you injured a lot of the ligaments. So when you got prolotherapy, we're doing the pubic symphysis, your right hip we did, and then of course the ligaments in the lower back, and these would be some of the ligaments. And then you would continue to have the grapefruit, because what it is people with pelvic floor issues or muscle tension in the pelvic floor, when the muscles tense, it closes the sacroiliac joint. Like, in other words, the body's going to try to have a person have stability. So you fractured this, injured a bunch of ligaments, there's a lot of instability. So the body, to try to keep the pubic symphysis together, to keep the innominate bones here together, it was clamping down on the muscles here. And then of course there's a whole bunch of nerves that if the bones move too much, then you've had different kind of nerves that have been irritated. This is the left pubic ramus here, and you can see it's this size, and then this one, you see how big it is, because there's a fracture right here, and then of course there's widening of the sacroiliac joint. You had a complex fracture of your pubic ramus there. You could see how the body, how it healed it, but now your pubic symphysis, they don't line up. So the body overgrew bone to stabilize that area. And then to stabilize the pubis, the hamstrings contract, the gluteus muscles contract, the erector spinae, the abdominal muscles contract, and what those muscles do is to try to get your sacrum, your innominate bones, and your lumbar spine in a stable position. That stable position is posterior pelvic tilt that puts the innominate bones in the right alignment. Nutation of the sacrum, which the muscles that do that is the erector spinae muscles, and then the lumbar spine is supposed to be extended. So that's why you had mentioned earlier, like you were hyperlordotic. Your body was attempting to try to keep your spine in the most stable way, and it has to be stable for you to actually walk and do all the exercises that you do. So basically, you've done a lot of soul searching, and what would you say are the take-home points now that you're almost 3 years into it? Like, what have you learned about yourself?
Well, if you had to summarize it, it's don't sweat the small stuff, because everything is small stuff. At least you didn't break your bone. It's a relative term now. There are so many bigger things that could happen to you. So I'd say throughout my day-to-day, I'm much more calm. Just ask God to lead me in figuring out a solution to whatever thing happens. So I say I felt like my faith got stronger throughout this whole process. My ability to put aside my own need to control everything obviously went out the window, because I had to have someone wipe my rear end, you know. So I mean, seriously. So I mean, talk about going from like total control to like you can't even like use your hand to wipe yourself. So I had to let my friends love me and help me, and the journey is the part that you need to actually enjoy. Like, I think about that first time getting on the table to get the first round of Prolo. I mean, and there probably were 6 people in that room praying, crying right alongside of me and helping me. But here I am, you know, now on the other side of that, still not 100% better. But when I'm out there in the waiting room passing through and someone else is sharing about what they're going through, I can 110% much more relate to what they're going through. A lot of our patients are neck patients, obviously, but it's a very similar situation. You can just move and then, you know, something happens. So the other take-home point is not to give up. You know, I'm into the 3rd year and still getting myself back. And I think, you know, praying to God and asking Him to help you is key, because I mean, trying to just do everything yourself is not going to help. Like, you can go to a certain point, but you know, God gives you like amazing wisdom. He gives you ability to handle pain, handle depression or sadness. And I was working on this presentation with Izzy, and it was just weird how like throughout the pictures I took were these different inspirational things that I had snapshotted just for myself, because then I would look back at those, and those are things that encourage me. So, you know, you need to like fill your mind with things that are positive and encouraging. And if you're watching like negative television or YouTube or around like toxic people, you know, like you can't have that. Like, especially if you're going through like a healing process like this, you know, you need to have everything toward the healing. So that means, you know, like I've also worked on my computer setup, you know, because I injured my neck, you know, so I'm definitely in the lookup zone with the computer. I'm working on my posture, and with Dr. Gray, we're working on strengthening the upper back and the lower back and lots of other things. But, you know, so I'm much more cognizant of my whole spine and just how I move throughout the day. And I think that's a lifestyle thing that needs to stay forever. But you should be able to trust your friends and lean on them and trust God through the process. And you know, it's easy to say don't give up, but that is kind of the message throughout the whole process, is not to give up.
We look forward to hearing from Dr. Gray, and thank you for sharing your story.
Thanks for getting me back on track.
Well, welcome everybody. As promised, we have Dr. Scott Gray in house, former tailback for Butler University, Indiana State football champion, and physical therapist extraordinaire. Obviously Scott, Dr. Gray, we've spent time together socially and everything, and you've been instrumental in Marion's healing. So we'll get her back here, and then you'll illustrate a few things like what you found with her. And Marion and I just are very grateful for what you've done for her. And really, it's been about a year working with her.
Yeah, absolutely.
And you're a physical therapist that kind of thinks outside the box, so you're in private practice with Ashley, so we have that in common, the
Right.
couple, trying to run a business here. And why don't you just explain about your centers that you have here in the Fort Myers and Cape Coral area, and then maybe how you're a little bit different than the average physical therapist.
Yeah, that's a good point. So we've got 4 different offices. Actually, these are our 2 brick and mortar ones that we have. One here is adjacent to Caring Medical in South Fort Myers, and then our other one is in Cape Coral. And I think the big thing that you kind of alluded to, Ross, you hit the nail on the head, is that we're a little bit different than most traditional places from a physical therapy standpoint. I actually don't even like calling myself a physical therapist at times, because ultimately they've had a bad experience with it, and they think physical therapy is like stretching a hamstring, or maybe like going on a bike or putting on a heat pack, or only handling like after surgery type of things. And it's not just that. And so I kind of think of us kind of like very similar as like a prolotherapist in a way. We assess the movement system of the musculoskeletal system. And so, I always tell our people that aren't sure what physical therapy is, we're kind of like a chiropractor in that we can crack a joint if it's stiff. Mm-hmm. We can needle muscles like an acupuncturist if muscles are like tight type of thing. But then ultimately, like if they have something wrong with the way that they're moving, we can fine tune that by mobilizing a joint or even exercise to either get the muscles working around the joint, that type of thing. So that's I think what makes it a little bit different than most type of places where they may be seeing 3 to 5 people at a time and they're just putting out symptoms. Or we ultimately want to like get to the root cause of something.
And then we've even sent you some people that had neck instability. So I would just say that you specifically and your team, you guys understand joint instability, because I've told you before, I've went to physical therapy places, even talked at physical therapy places, and they just didn't understand the ligamentous component of joint instability, that it isn't just muscular strength that relates to stability, it's obviously ligament strength too.
Mm-hmm. All right, so Dr. Scott here again. I'm here with the wonderful Mrs. Hauser, and so I have nothing but great things to say about this lady. I know obviously those of you that have watched a lot of the Caring Medical broadcasts and things, you've gotten to know Ross and Marion, but I know Marion at a different level, like as a patient, also as like a friend and like mentor. And so I think if you ever get a chance to sit with Marion and just chat with her, she's such a very kind individual. She's a dedicated individual. She's all positive energy. And I think that she brings off good energy to the world, right? And so I think we can learn a lot just from Marion in that regard. And then I think just from a treatment standpoint, Marion has been wonderful as a patient, because I think she's been dedicated. And a lot of times, especially in her cases, we'll go over it. Some of it involved me really working on things like restoring motion and things like that, but a lot of it was like her hard work having to get her pelvis stable, to getting her hip stable, to getting her spine stable again. And so
it's been amazing too for me, like to get myself back to where I was. I'm not all the way there yet, but I'm there. Yeah. And then also what I really appreciated about Back in Motion is like you treat your clients as family, as friends, and you have your dog there and he's awesome, and your wife works there and she's fantastic, and your whole team is amazing. And it's just not the same physical therapy that what the average person thinks. Right. So I think I learned so much about my own body and then how to help our patients, like having gone there as a patient myself.
Sure. Yeah, so with Marion, so she had broken the suprapubic ramus here, which is this top part of the bone of the pelvis. And, so all that stuff had kind of resided, like they've gotten imaging and they saw that the pubis was stabilized in that, but she was still kind of having like some different symptoms. And to be honest, initially I was kind of like stumped a little bit, because it would, go from one side to the other, vice versa. And, I was like, man, what is going on? So that's why I kind of thought initially she was getting like a little bit of like pelvic floor spasm and guarding. And so some of these pelvic floor muscles, some of them actually come around the back of the butt, and they come back around, and the pelvic floor really just kind of supports your organs and your pelvis in the bottom of it. And so you can get, an array of like crazy symptoms, especially it makes sense with her, like, she had some instability in that, and those muscles can guard to try to provide some stability in her case. And so she came back to me after I talked to her, and I said, hey, like, how are you doing? She's like, well, I'm still not there yet. And so I said, hey, let me take another peek at it. And so I found some different things clinically that I had seen before, and really what I had seen was that like she couldn't even, I hope you don't mind me saying this,
That's okay.
like stand and balance on her right leg. She had like no hip stability, right? And so
yet I'm running and cycling.
Yeah.
So that's what was so shocking.
Right. And then what we had also seen is like some of these muscle imbalances, and so a lot of times certain muscles will have a penchant to getting tight and facilitated, while others become like weak and dormant. And so with her, like she had like this textbook like hyper like lordotic lower back, and then she had her pelvis was kind of like rotated in this like anterior tilted position, right, or rotated forward. So what that does is like makes the abdominal muscles shut off a little bit, but also then just really puts a lot of tension on some of these posterior structures and even like the hamstring. But it really does is it shuts down the hip, like the glute muscles and some of those deep muscles. And so like what we had really saw is like she wasn't getting a push off into right hip extension. So she was getting a lot of these crazy symptoms of like off the ischial tuberosity, a lot of these soft tissue things, but basically what we had seen was her glute was really weak, and then her abdominal muscles weren't also on the other side balancing the pelvis into this neutral position. So these muscles the length tension of them was off, and so she was further creating more muscle imbalances.
Well, I remember when you filmed me the first time running.
Yeah.
I mean, it was almost like I was like going like this.
Yeah, exactly.
And that was very telling.
Yep, it was like really kind of eye-opening.
Yeah.
And I noticed too, like just even when we put her on her right leg, her knee would like super cave in compared to her left side. So we knew there was some definitely like proximal hip rotators weakness going on. And maybe talk a little bit more about your abdominal strength stuff. Like, I mean, we would do some of the testing, and then you noticed you weren't able to keep your back flat, or you couldn't even like do a sit-up, right?
No, I remember that first one on your table.
Right.
I'm like, I can't get up.
Right.
Yeah. Well, you did muscle stim on my abs.
Yep.
So that's an interesting experience. But
yeah, and I think to your point, right? Like a lot of times after an injury, you get these muscle imbalances, or even if you were to get your knee replaced, right? And we don't typically recommend that, or even an ACL injury, your quad muscles shut down, and so like you think the ab muscles actually attach up here high, and so a lot of her abs had kind of.
No, I mean I would tell you like I'm pushing right here and I don't feel it.
Right.
Like so from the belly button down, like the lower abs, like definitely couldn't feel those at all when I came back, and that's only like a year ago.
Right.
This right here I could feel somewhat. Like it totally makes sense why I wasn't getting to the next level, because all of those things were not firing or functioning.
Yeah, that's right. That's right. Yeah.
So, and it felt like a hamstring injury because I've had those for years. But the most eye-opening thing was the inability for me to stand on one leg and literally or to try to go down on like do a one-legged squat.
Yeah.
I mean, and like when I do them now, and you have me going up on that box, and I'm just like, I can't even believe I'm doing this. It's so amazing. It really is key to put the whole puzzle together. So you did the muscle stim, and then we just kept working on it. The glute thing has been a huge part of it too. And I think that a lot of people who, like me, I'm at my computer a lot, that probably worsened it also. I mean, you could speak to that. Like you have a lot of people who are sitting.
Ultimately, like our bodies were made to move. We weren't made, as like Dr. Ross and Marion have mentioned, like sitting and looking at our phones and computers all day is like potentially not a good thing for our necks, but also even the lower extremity, like, right? So when I'm sitting all day long, it shuts down the way that my hip should work, it shuts down the way my knee should work, and so a lot of times we can get dormant and weak glute muscles, stabilizing muscles around the pelvis and spine, and so it's a full body picture, and so to Marion's point, like sitting for a prolonged period of time. Yeah, it's
Well, I know, but then you
Yeah.
had me doing stuff in the office, so you gave me a
Yeah.
Mackenzie roll
Yep.
to put behind, so then it's like if you push against it, then you're, engaging your
Yep.
abs. And then the other thing that was big for me too is the
posture.
posture
Yeah.
and, putting the shoulders back. We work a lot on that. We're still working a lot on
Yeah,
it.
sure.
But I think the whole point of this too is like you say the Gray method, it's
So we got the thoracic
lumbar
spine, the hips, and the feet. Yeah, those are
and
usually
the
like
feet.
yeah.
But you just see like the whole body mechanics is a process. And then especially if you're, one, recovering from an injury, but two, you're active or participating in sports,
Right.
you can see where it's something that you need like all the time.
Right. Yeah. Yeah, I think Marion hit the nail on the head. A lot of times you need like to fine tune your body, but you get stuck in these postures or positions. Even if you are moving all the time, right? If I'm an athlete or runner, even though I'm moving all the time, they get super stiff ankles, right? Or their hip gets super stiff.
have that
And so sometimes you have to, see like a manual therapist to work on some of those muscle imbalances or get those joints moving, because the body's going to go through that path of least resistance. It's like, Ross and Marion talk about, and eventually that can turn into instability, right? Up and down the chain anywhere.
And the other thing that's really interesting to me with your type of physical therapy is that we're in the room for some of it, but then we're out in the gym for the other part of it.
We have these passive treatments, like where you might get muscles to release or relax, or you may, get a joint moving, and that's where we do a lot of the hands-on stuff, or we'll needle. But ultimately, again, like our body heals with motion, and so that's when we will load certain tissues. My bias, being a former athlete, is you have to get people's tissues stronger. And so the more stronger you are, you're harder to kill. That's kind of like a thing we always say at Back in Motion, and you're more resilient. And so that's ultimately like what we did with Marion. A lot of it was like she needed to get stronger and more stable at her pelvis and hip, and that takes a lot of hard work and dedication. And so I think I give that to you, like you're a trooper, right? Like not a lot of people that go to PT there or whatever, they're like, man, I don't want to do this. I don't want to put in the work. And like she needed to, she ultimately needed to put the work in, and she did it, so.
Yeah. Well, and then you said to me at one point, do you want to move into doing personal training also? And I'm like, no, I don't have time for that. I don't know when I would fit that in, and maybe I'll try, I don't know. But, I do a lot of leadership things, and one of the things that finally hit me, like, you need to take the time and do it. Like obviously it was the whole first part was a big journey. The second part is the first journey. Like, no, I'm not doing that. So you also have personal training at your facility. Do you want to speak about that? Because that's been absolutely awesome to do that.
Yeah.
I mean, because we're doing cardio, we're doing strength, all sorts of things. I mean, I'm sure there's a method to it that I don't even know about, but it's been amazing for me. And obviously I brought a friend along, and she's doing it with me, and she's seeing tremendous results too. So, I mean, I think as we get older, all of us are aging, obviously, but strength training is like just absolutely vital.
Yeah.
Like, to me, if I could only do one thing, that's probably what I would do.
Yeah, it's kind of like the wonder drug. Like I think a lot of times we forget, like when you're just stronger, things get easier, right? If you're like super fatigued, like walking up and down the stairs or whatever, obviously there's a cardiovascular component, but if your leg muscles can barely lift and walk up a stair, like you're going to get better just by getting stronger, right? Like if you wanted to sit more upright in the posture throughout the day so you don't slouch, right, and get forward head posture, sometimes you need to also just get stronger and your muscles don't have to work as hard, right? And so that was just a big eye-opening for me. And also, like, you have these hormonal effects that go on in your body, from like anti-aging to lean muscle tissue mass, and like just even like mind clarity, and like reduce of depression and
Happy hormones.
like, so
Yeah.
again, it's like the wonder drug, and it's the best part about it, it's free most of the time. You just got to pick heavy stuff up safely, right?
Throw it at the wall.
So
I learned how to do that too.
So anyway, like we started looking at a lot of this stuff, and that's a lot of what we do with our clients. Is we don't do just dip this long, like they're on an elliptical for an hour time, right? Like it's that's what the research shows, like to develop lean muscle mass and keep people resilient. So that's kind of like the Back in Motion way we like to think. And we kind of have 7 different fundamental movement patterns. If you study man and cavemen when they were chasing their prey, right, they would sprint, they would jump, they would bend, lift, twist, push, pull, hinge things. So we try to incorporate a lot of those like fundamental key movement patterns that we did as primates into people's training. So a lot of times people don't do that anymore. And so speaking of which, I think we actually have a session coming up, right?
We actually do. Well,
Right.
thank you so
Yeah.
much. I'm eternally grateful.
Likewise.
Thank you.